DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show today. We have Dr. Matt Meisner joining us, and we're going to talk about some things coming up on this show season. We're going to talk about ringworm and warts and different things that can grow on the skin of cattle. Stay tuned after these messages to listen more from Dr. Meisner.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Matt, welcome to the show.
Glad to be here again.
Folks, this is Dr. Matt Meisner. He's an associate professor here in our veterinary health center at Kansas State University, where he sees a lot of animals. He's one of our medicine and surgery specialists here for beef cattle. Spend a lot of time down in the clinics.
Yeah. In fact, you managed to get me to come back here.
We kind of had to snag him away from a case, actually, leading right into what we're doing today. And we're going to talk about warts and ringworm, but we thought we'd start out by talking about some wart issues. And I didn't realize there's so many different types of warts.
Yeah, I think that people researching these kind of things in cattle, we see everybody thinks, well, I got warts, and but the research showing they get up to 15, 16 different strains of just bovine-specific papillomavirus or types of virus that causes warts in cattle. So a lot of them, and so they're not all created equal, that's for sure.
And you're talking about you can get them all kinds of different places.
Sure, and so each of those strains generally have a specific area they like to grow in, and so you got a bunch of different skin types, which we're used to seeing these big old giant tumors looking on cattle. Some that are specific for the reproductive tract, the penis on bulls, the reproductive areas on cows. We've got areas that tend to like to form in the esophagus and the intestines, you name it. And so each of those strains kind of wants to go to a certain area.
Okay. And then can you, I mean, obviously based on the placement of them, but then can you send them in and get diagnostics on them or things to that nature?
So, I mean, I think that it's pretty, when you see a wart, it's pretty predictable as to what it is. You know, we don't necessarily need a biopsy to prove that it's a wart. What we see is sometimes more of the clinical problems with those types of things, and so they can get out of hand, or they can cause bleeding in certain areas, especially the reproductive tract, that hinders sterility in bulls if you've got blood in your semen with that kind of thing. So we don't really need to necessarily biopsy to prove it, but certainly there's some things that it could be, and so occasionally we'll look at them and maybe this wart is characteristic of some other type of a tumor, and so we may want to, but most oftentimes warts are pretty predictable.
You mentioned that these are caused by viruses, papillomavirus. And so it lends me, we have pretty good vaccines against viruses. Can we have vaccines against warts?
Yes, and there is at least one licensed vaccine against warts. And when I mentioned there's so many different strains of that wart, this vaccine tries to incorporate as many types as possible. And actually the company we'll solicit submissions from veterinarians or producers to try to get more strains. Okay, so this is only one that doesn't. It tries to encompass all of these, and so as vaccines would be, sometimes it's effective, sometimes it's not. But that's about the only way to truly get some sort of immunity against the virus.
And you said that's in Colorado?
Well, the company is Colorado Serum Company, and I'd have to remember where it's from, but that's the one vaccine that I know of.
Cool. Well, many different types of warts. Best prevention is going to be a vaccine, Colorado Serum Company. We're going to come back a little bit and talk with Dr. Meisner about how we're going to treat cattle, how long it takes for the clinical signs to go away, for the warts to be gone. Thanks for watching Doc Talk. More after these messages.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
Talk, Dr. Dan Thompson here with Dr. Matt Meisner. We're from Kansas State University's College of Veterinary Medicine, where Dr. Meisner is an associate professor in the Department of Clinical Sciences, and he's also our section leader for our livestock services section.
Yeah.
Changed the name.
Yeah, we did.
No more ag practices. Now we got livestock services. But basically, he is an internal medicine specialist that sees a lot of cases here, a lot of cattle coming through our clinic, specialty cases, regular cases, and we're talking about warts. So, you know, we get a calf in here and, you know, it's fair time or whatever, and someone comes in and says, oh, shoot, I got a wart I need to get rid of. What are we going to do?
And there's probably, kind of to that, there's several reasons that we'll see it. One would be show season, 4-H season, and warts on the skin are going to be one of those things that don't allow you to go into the fair, because it is a virus, it is a contagious virus, it is one of those things that they don't want to have there. Not only is it unsightly, but it's one thing. So that'd probably be one of the reasons we'd see it. And so if you think you've got warts, or you know you've got some on these, you're wanting to plan ahead to get rid of them at least a month before you go. And as we have for prevention, meaning a vaccine against a virus, the way that we treat these is to try to remove them. And sometimes it's a matter of just surgically removing them. We freeze them, we burn them off, we do a whole bunch of things, and we leave a little wart. And that being that it's supposed to stimulate the immune system to fight off anything else.
So it's kind of like a natural vaccine then. Right. You irritate it, the viruses get an immune response, and then it prevents others from forming and then also attacking the
ones that are there. Yeah, so you're hoping that you're internally stimulating the immune system to fight it off. And but it takes time, you know, so we can remove it. We're going to have some wounds that need to heal, but we're also going to have to take time to let the body heal those up.
Yeah, so at least a month ahead of the fair or wherever you're going to show that animal, we need to get after it and try to get it done.
That's for skin ones.
Now, penile warts.
So penile warts, bulls, reproductive exam, breeding soundness exams in the spring. Very common to notice warts in young bulls. Most of them will resolve on their own as their immunity develops. Okay, but if they test a bull and they see a wart, certainly anything on that wart when he tries to breed could cause bleeding. Bleeding's not going to allow him to get have a successful pregnancy, because that's going to hinder it. So then we'll possibly talk about taking that wart off if it doesn't go away on its own. And again, planning ahead. We usually try to take these off, remove the wart, check them 2 weeks, make sure it's gone. Okay, some of them are really persistent and they don't want to go away. So a lot of times, we'll see these we have to treat multiple times, before they go. And but again, planning for at least a month ahead to get this stuff cleared up. 60 days prior to, or at least a month prior to breeding season, this thing needs to be cleared up, and those kind of things.
So, and you probably take those off the same way, excise them or
So,
freeze them?
Surgery, freezing, we do some laser therapy in the clinic, so some of those kind of things. And so there's multiple ways to try, and depending on the strain, sometimes they're a little difficult to get gone, so we need to plan ahead.
Ever vaccinate in the face of already having warts?
Yep, we do that too. Just trying to see if we can stimulate it. But usually that strain is going to be fairly specific.
Cool.
Yeah.
Well, let's take a break, and then we'll switch gears to something a little more itchy.
Sure.
Ringworm. Folks, thanks for watching Doc Talk. Dr. Matt Meisner, Dr. Dan Thompson. More after these messages.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
DNA Dialogue is brought to you by Igenity Beef, powered by Neogen.
When it comes to genomic technology and genomic testing for the commercial cow-calf operation, one of the biggest questions I get is why invest in the technology? And I think a lot of times the benefit of genomic testing is really the ability to peel back the calf's hide and really better understand the genetic merit of the replacement heifers that you're selecting. Because if we think about the biggest investment that a commercial cattleman makes, especially if he raises his own replacements, is to raise that heifer from birth to the age of 16, 18 months at preg check time to realize that she didn't get pregnant. And so one of my favorite conversations to have is really, let's talk about genetic variability. Because if we think about the monetary investment we make in a bull, right? You as a commercial cow-calf guy, you go to a bull sale and you do a lot of research. You phenotypically look at that bull, make sure he matches what you like, make sure his conformation is sound, and we hope that you look at the EPDs that come in the bull sale catalog. But what some people don't understand or even think about is that in that full sibling mating, there's over 1 quintillion possible combinations of DNA in a single calf that bull can make. And so that is what genomics brings to the table. We're able to look at the DNA that passed down from that bull into that heifer so that the commercial cattleman can select the females that are inheriting the genetics that he paid for.
We know how expensive it is to keep and maintain heifers. What is also the fallout of those heifers if they're not the correct ones you're keeping and maintaining. We want to do as much as we can to get it right before we spend the money to impact our herd further down that road and keep successive females out of the wrong type of females.
Igenity Beef. Contact your Neogen territory manager to test today.
The Alertus on-farm pregnancy test for us has been unbelievable time saver because we can do it whenever we want. My favorite part about Alertus on farm, we can get results fast. In 20 minutes, you know whether that cow goes to pasture A, B, or C. It's just very efficient. It's going to make you a lot of money. You're not going to have open cows standing there all winter looking at you, and you can do it on your time.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Meisner, who is an associate professor and the section head of livestock services our practice here at Kansas State University's College of Veterinary Medicine. Does a lot of work teaching, is nationally acclaimed, and does a lot of speaking out there at veterinary meetings. Glad to have you on the show. Grab you out of right when he's heading out of the clinics in the truck to go work on a case. Said, hey, you mind shooting this real quick? But anyway, ringworm.
Yeah, another fun one. And I apologize. Yeah, I didn't have time to go through makeup and hair today, so not a big deal. Ringworm's another one of those skin problems, and when we talked a little bit in the past about warts, and ringworm gets a name of worm, but it's actually a fungus. Okay, and it can sometimes look like warts because sometimes it gets kind of a crusty surface to it, you know. So, but ringworm is actually not a worm; it's a fungus. And it's a contagious fungus. It's another one of those skin things that'll keep you out of the fair because they don't want to have that type of a contaminant in the environment or on other animals to create other problems.
Mainly contagious cattle to cattle, but there could be some issues, you know, where it could be zoonotic, right?
Right.
Or from cattle to people.
Yeah, so sure. I mean, it can go from critter to critter, from critter to post to critter, it can go critter to you to critter, and it can go, some species of ringworm in animals can be transmitted to people to cause clinical problems, some severe itching and other things, and some people are more susceptible to it than others, but ringworm, you know, some of this are, again, a bunch of different species of ringworm, and a lot of them are species specific, and cows generally get cow types, and goats and cats, but some of those species are certainly zoonotic to you too.
I've had clients come in and had ringworm on a cat, and then you look at their arms, and
yeah,
it's on their arms or wherever they're holding that cat.
Yeah, just
be careful.
Yeah, it's not pretty.
And then, you know, you said there's no vaccines for this.
Right. So, unlike the warts or other skin things where we've got a typical virus. A fungal type situations like this, there's really no preventive mechanism like a vaccine for it. It's one of those things, you either clear it or we treat it and take care of it.
So they're picking it up where?
In the environment. And so again, usually it's an animal that's had it, they're carrying it, they're contaminating the environment with it, and it can reside in various areas. As long as it's in the right environment, it can last, and an animal can rub up against a post or a gate or anything and manage to get it in that situation too.
So we're going to look at you know, prevention basically is going to be, if you have an animal, you're going to isolate it, and then the rest of it's taking care of the environment and making sure that we get it cleaned up.
Sure. Yeah, you'd want to, I mean, you know, a lot of areas will be self-cleaning and get sunlight and those kind of things, but moist, dark areas and a bunch of crevices can hold it, and then you got to be careful with that kind of a thing.
You think about some of the show cattle that we keep inside or keep them in cooler boxes, things of that nature.
Yep.
We might want to disinfect or scrub down those cooler boxes.
Right. Yeah. Yeah, those kind of things. And then again, be careful with on those, but moist, dark areas, and
wear gloves.
Wear gloves.
All right, let's take a break. Folks, you're watching DocTalk. Dr. Matt Meisner here. When we come back, we're going to talk about how to treat ringworm after these messages.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at IDEX.com/DocTalk.
It's the drive, The passion, the unbridled desire to be the world's greatest. It's the early mornings, late nights, and every hour in between spent grooming the next generation of champions. We're with you through the best times and the tough times. Seeing your horses through inevitable health scares and setbacks you never saw coming. Everything they deserve is here, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. I'm here with Dr. Matt Meisner, who's an associate professor in the Department of Clinical Sciences and the section head of the Livestock Veterinary Services here at Kansas State's Veterinary Health Center. We're talking about ringworm and the fungus among us, and you know, when we get dogs and cats and people, that we can use some not just topical things, but we can actually treat them with antifungals, systemic antifungals, and that we don't do that much in beef cattle.
Don't do it much in cattle, and the reason being is it's fairly expensive. Being ruminants, it's hard to get the volume that you'd want into them to be effective against treating these kind of things, and so in almost all situations it's not really practical, and we don't even really know how effective it is in some of these to give a drug like greaseafulvin is the drug that a lot of people would get, or a cat might get or something, but not going to be something that we pick off the shelf really readily.
And we're eating these animals.
Yeah.
And so, withdrawals and things like that and some of these products. But so when you start to think about, well, I'll go get my veterinarian to give me something that's internal that we had a cat and we gave it this and it dried it up, probably not going to be the same. And lot different decision process in that, and not just cost, so again, effective, cost, withdrawal times, those kind of things. So systemic treatment is pretty unlikely, and that's really, some of those drugs are really the only ones that are proven. There's some theoretical treatments with iodides and iodines and other treatments that have really not been proven, certainly have their own side effects that have been attempted, but really not proven. The only things that you can really do for these are treat them topically, clean them, betadine type things, and sun drying. There's been a bunch of witch magic out there with flower treatments. I'm not going to mention names on these because it's not right, but there's been some things that diesel solvents and a bunch of different things to try to dry these out that have been tried, again not proven, and maybe more irritating than good. But there's a bunch of ringworm it creates a bunch of desperation because it's a hard one to get rid of, and so. And I think that the other thing is, as you mentioned earlier, fungus or ringworm in humans versus cats versus dog and cattle can all be different.
Yeah.
And so trying to buy all over-the-counter stuff for humans isn't going to probably work on cattle. Again, getting back to iodine, scrub, cleaning it, and getting it out in the sunshine and drying them out.
Yeah.
A lot of them self-resolve.
Yeah, a lot of them will clear up on their own. And I think a lot of it has to do with the individual's immune system. Some people are more susceptible to it. Some cattle are having trouble getting rid of it, and it has to do with just some of their immunity or ability to fight it off on their own. And so that's something we kind of keep in the back of our mind as well.
Wow. It's been a great show. I always appreciate you coming on and spending time with us. And, anything else on ringworm or warts or...
No, I mean, it's frustrating, and I feel the pain of the producer a lot of times when we're trying to get these things cleared up, and it's just it can be a lot of work to get them gone.
Make sure you plan ahead. Make sure you work with your local practitioner, and if you want to know more about what we do on DocTalk, you can find us at www.doctalktv.com. I'm Dr. Dan Thompson here with Dr. Matt Meisner. We're at Kansas State University's College of Veterinary Medicine, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier